Hi, I'm Dr. Neal Zomback, Complete Foot Care. We're located at 60 Temple Street in New Haven. We also have offices in Milford at 140 Clark Street and 478 South Main Street in Cheshire, Connecticut. I'm here today. I just want to go over one of the most common ailments that we see both in athletes and non-athletes. It's called heel pain syndrome, also known as plantar fasciitis. Now, typically this particular problem is something that we find where a person will wake up in the morning and they can barely put their feet on the ground. It can be sharp and radiate. It also bothers them at the end of the day, or if they've been sitting, say, in a car or at a table, and then they get up and they find themselves limping. The pain is typically located in the inside area of the heel or the center of the heel, and it can extend up into the arch area. There usually is not any swelling, and the pain can be sharp, like I say, but it's usually a dull ache. Now, treating this problem is one that should be done in an aggressive fashion, because the longer one has it, the harder it is to get rid of. So I take this and I attack it very aggressively. Over here is an example of the kind of treatment options that we provide our patients. Usually in the first visit, we'll identify what the problem is, typically take an x-ray, see if there is something called the heel spur, which is not a bad thing. It just tells us that the pain and inflammation, certainly the inflammation has been going on for a long time. The pain may not have been. In particular, if we look at the different treatment options here, typically one of the key or the foundations for healing is basically supporting the foot. Now, we may use a tape job or a strapping. A lot of times I'll make a removable sleeve type pad that can be used when people are barefoot or in their slippers. But for everyday use, we usually give them right off the bat something that's a medical grade support, maybe a Linko, something else that I can customize for the patient's needs. Ultimately, more times than not, the treatment solution is something called a custom orthotic. A custom orthotic differs from an arch support in that it has posting or correction that changes the position of the foot so that it doesn't get overused or overstressed, the typical problem that leads to plantar fasciitis or heel spur pain. Usually involves some type of stretching. We will give the patient a foot roller a lot of times, often a anti-inflammatory medication, but also I'm a big believer in homeopathy. So I'll prescribe medicines that are natural. A lot of times we'll do a topical type medicine called BioFreeze, works very well, and people can use this multiple times a day. Along with the insert, shoes are extremely important. One should have a shoe that's got a firm counter, which means the heel area is very stiff. One that has a removable liner or bed so that you can put your orthotic or your temporary insert in there in place of that liner. You should have some type of a supportive cushion midsole. A lot of times, depending on the foot type, we'll recommend a multi-density midsole. And this should have flexibility here with rigidity in the shank. I shouldn't be able, or one should not be able to bend the shoe in the middle. So in dealing with this problem, it's a multifaceted approach. Sometimes other things like physical therapy and night splints are needed, but 90% of the time, surgery is not necessary to treat this problem, and it can be resolved. One can continue with their athletic activity or their daily activities without a problem. Come down and see us. Thank you very much for your time.